Welcome to Healthcare Igniter series. For context, Healthcare Igniters are the thought leaders who have ideas for 10x impact. Our today's Healthcare Igniter is Ismael Villarreal. He is Vice President of Supply Chain Operations with Cardinal Health. He spent his entire career delivering tangible results and improving operations. So thank you for joining the chat here.
Thank you for having me, Pranav.
So Ismael, our mission here is to improve quality of care and reduce cost of care. Help us understand the importance of supply chain to the mission here.
Absolutely. Having an effective supply chain is absolutely critical nowadays. Can you imagine a hospital not having the medical device that they needed or not having the medical supplies? Can you imagine that?
Mm-hmm.
It's hard to believe, right?
Yeah.
So definitely they need it. So having this synchronization and making sure that the healthcare providers have the right material and the right device is critical for care.
Significant. It seems like supplies and medical devices have become arms and legs of clinicians, if you will.
Yeah.
Now let's talk about the scale and impact that it could have on a hospital system, if you will.
Yeah, absolutely. So there are some studies that have shown that clinicians and nurses, they spend 20% of their time locating their materials, managing their supply chain. While they could do more work of care, they are spending this significant amount of time, and it's pretty significant. How much is that? Well, if you think about it, on an average hospital of 160 beds, this could be very well about $10 million.
$10 million.
$10 million in their operating expense.
That's very material.
It is, and definitely it's an opportunity that is out there.
Huh. So just saving time from a clinician side will just get them $10 million. I bet there are other opportunities around there as well.
Absolutely, there's definitely other opportunities. You know, obviously the effectiveness of the supply chain, the main goal is to have the right product and the right device and the right time. But the other side is having an overstock of the material. Again, with the fear of running out of product while you cannot locate the material, often clinicians or nurses order additional material. How much additional material? Well, we have found that on average, the average hospital, they have anywhere between 15 to 25% of overstock.
Oh my goodness.
That is very significant. Translated into dollars,
yes,
that's basically an additional $6 million of opportunity.
$6 million. So
yes,
for a 160 bed hospital, $10 million plus $6 million, almost $16 million. Some might be just cost or some working capital. That's very significant and tangible, if you will.
Yeah, and you know what, Pranav, I think it's also important to mention the intangible side. Again, the effect of not having a good supply chain create a lot of anxiety on the nurses and the clinicians. Yeah. On top of all the work that they need to invest for providing the right care, on top of that, they need to start researching, locating product. That creates a lot of stress and anxiety. Yeah. And nowadays, it's difficult because we all know our industry is facing one of the largest shortages on nurses.
Yes.
And missing one nurse, is very significant and impact the providing the care, right? So it's something that we need to consider as another impact of not having an effective supply chain.
Very true. So tell us, what should health systems or hospitals do to really up their game?
Yeah, I always say go back to basics. Let's go back and use the Lean principles. There are very simple tools out there. Visual management, Kanban concept. Now, often I hear, Ismael, that works great in manufacturing, that works great in distribution, but in hospitals and labs, that doesn't work here. And I would say it's absolutely not true. It is a concept that's very easy to implement in hospitals and labs. I've been very fortunate to be invited by and be part of those implementations. Recently one in Puerto Rico in a laboratory, and immediately they saw a significant reduction of their inventory. Their BOE, voices of employees, increased significantly just by utilizing lean concept. Now, there are also some technology out there that you can use. It all depends on where you are in the, as a business, right? But there's RFID, there's also opportunities to integrate IT systems. There are very sophisticated systems out there where you are able to see where the material is in the supply chain, and that helps you to optimize and first deliver, and have the product in the right time and the right location, but also to optimize your inventory and reduce the time of managing your supply chain. So there are a lot of quick wins that anybody can go tomorrow, but at the same time, you can develop a roadmap and take advantage of what the technology that exists out there.
I like it. I think small things you can do could really yield large results in terms of dollars and cents. And what I really like about it is unavailability of supplies and device means unavailability of care, and too much is a cost. So in our context, basically you address how you improve quality of care by making things available, reduce cost of care, and also improve clinician experience, which should translate into patient experience.
Absolutely.
And all that is extremely important.
Absolutely.
Thank you for sharing these thoughts, Ismael.
Thank you for